Good morning, ma'am. My name is Ryza PSN1 from Mindanao State University Main Campus, Ryza Extension. And for today, I am going to perform on how we properly assess nose and sinuses. But before I begin, let me provide some brief context about a assessment of the nose and sinuses. So for the definition, it is an evaluation of the structures, functions, and the potential abnormalities of a nasal cavity and a paranasal sinuses. And for the purpose of assessing nose and sinuses it helps assess for the infections, it evaluates structural abnormalities, and also detect allergies, reactions, or the foreign bodies. And for the equipments that we're gonna be using po are water, liquid soap, towel or paper towel for hand washing, and we do also need a pen light, the nasal speculum, and tissue or gauze. Then for the considerations before, during, and after the procedure, before the procedure, we must first sanitize our hands or do hand washing, then also obtain a thorough patient history, and also ensures that the equipments are ready and explain the procedures to the patient. Then during the procedure, we must monitor the client and also inspect and also during the procedure, we must the internal and external inspections, palpations, and a nasal patency test. Then after the procedure, we must document the findings and the educate the patients on the identified issues and possible interventions. And for the documentations, we must document the findings, the internal and external findings, and any abnormalities or any issues encountered while doing the procedure. But before I begin, let me do hand washing. And now for the procedure, first we have his nose. Inspect the external nose, note the size, color, shape, the flaring or discharge from the nares. This is to assess for the deformities, asymmetry, inflammations, infections, or the respiratory distress. And next, for the nose, we do also need to lightly palpate the external nose. This to check for the tenderness, for the swelling, crepitus, or any abnormalities in the nasal structures. Then, next is instruct the client to close his mouth and occlude the one nares, then breathe through the other nares. This to assess the nasal patency and detect obstructions such as the polyps, deviated septum, and the congestion. Next is Next is for the last part of the nose. Repeat the procedures with the other nose. This is to compare the airflow of the both nostrils and identify the unilateral blockages. Then next, for the nasal cavities, first we do also need a use of the nasal speculum and the pen light to inspect the nasal cavities. This is to visualize the internal nasal structures such as the mucus and the turbinates. Then next is for the nasal cavity, we do need to hold the nasal speculum in the right hand to inspect the left nares. Then we do need to use our left hand to inspect the right nares. This to ensure the proper control of the instrument and minimize the patient's discomfort during the procedure. Next is to ask the client to tip his head back, and branch your index finger to the patient's nose and gently insert the nasal speculum about 1 centimeter into the nares and open it as much as possible. This to stabilize the speculum, prevent injury, and allow the visualizations of the nasal cavity. Next is with the pen light, shine the light into the nares. This is to enhance the visualizations of the mucosa, the septum, and the other structures or the abnormalities. Then next is inspect the nasal septum for positions, the deviations, and intactness. This to identify the perforations, the other structural issues that may affect the nasal functions. Then gently remove the nasal speculum. This is to maintain the hygiene, prevent the contaminations, and prepare for the next assessment. Then lastly, for the nasal cavity, repeat on the other nares to ensure the complete and symmetrical examinations of both nasal passages. Then now, we're going to proceed on the facial sinuses. For the facial sinuses, palpate the maxillary and the frontal sinuses. This to check for the tenderness, which may indicate the sinus infections or the inflammations. Then for the frontal sinuses, we must shine a pen light into the inner aspect of the supraorbital ridge of the frontal lobe. This is to check for the sinus transparency for the potential fluid accumulation. Then for the maxillary sinuses, this is to instruct the client to open his or her mouth and shine the pen light to the left and the right. This is to detect the opacity, which may indicate the sinus infections or the congestions or the fluid buildup. And now we're going to proceed on how we properly do the assessment of the nose and sinuses. Mayong adlaw, ma'am. Ako po pala si Ryza po. Estudyante po ako ng nursing gikan sa MSU Batanasa. Ako po ang mag-assist sa imo karon, ma'am, ha? So, ma'am, pwede ko po ba makuha ang imong ngalan po?
Sofia po.
Sofia
Abdurrahman.
Abdurrahman. Ang birthday ni mo, ma'am?
February 20.
February 20, 2010. 15 years old, ma'am. Ma'am, confirm ko lang po, ha? Safia Abdurrahman po, February 20, 2010 at 15 years old po. Ma'am, mga akong buhaton nimo, ma'am, ay check po ang imong nose and sinuses po para po malaman natin yung position, yung deviations at intactness po. At malaman po natin kung may infection po ba kayo or problem po about sa paghinga nyo po or about sa sinuses nyo po at sa nose nyo po, ha? Pwede po ba yun, ma'am? Ngayon, ma'am, gagawin po natin as check ko lang po, ma'am, ang external nose nyo po. Okay lang po, ma'am. Maghawak po ako ng iba't ibang parte po ng imong lawas po. Okay lang po ba yan? Okay ko lang po, ma'am, ha? From the bony area to the bones. Wala naman pong ano, ma'am. Ma'am, pwede, ma'am, i-close niyo po ang mouth niyo, ma'am. Tapos, ilagay niyo po, isa niyo pong index finger po dito. Tapos, hinga po kayo sa kabila, ma'am. Pwede po ba yan? Diba? Gawin niyo po. Wala naman pong problem, ma'am. Nakabila naman po, ma'am. Okay naman po. Ngayon na, ma'am, gagamit po tayo ng pen light po at nasal speculum po. Ito po, ma'am, para to makatulong to, ma'am, para ma-easy access po sa mas ma-open po yung nose nyo po, tapos makita po yung internal sinuses nyo po. Pwede po ba yan? At ito po, ma'am, ito rin po makatulong rin po to sa atin, ma'am. Maganda po na po, mga pwede, ma'am, yes na. Lagay ko na, ma'am, ha? Ma'am, ha? Okay. Iisin ko muna, ma'am, ha? Lago po. Para po maiwas natin yung contaminated po. Bila naman, ma'am. Ayos naman, ma'am. Hindi lang po ako matali. Kasama po, ma'am, yung position at intactness po ng inyong sinuses po. Ngayon naman, ma'am, sa may facial sinuses nyo naman po, palpate ko lang po yung maxillary nyo po, pati frontal ano nyo po, ha? Frontal sinuses. Ano, ma'am? Sure. Ayos ka lang, ma'am. Ngayon, ma'am, sa may maxillary nyo naman po, open nyo lang po yung, ano nyo, ma'am, yung mouth nyo po. Mouth nyo pa, Bakit? 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 Wala naman po. Kabila naman, ma'am. Isa lang ako lang. Ito naman, ma'am. Ma'am, tapos na po tayo, ma'am, ha? Salamat po. Document ko lang po ito. Findings po. Wala naman po kayong problema, ma'am. Ma'am, okay na po tayo, ha? Then, For the final procedure, we must remove our gloves, our mask and gloves, and do hand washing.